For most of us, chickenpox is a distant memory. For some of us, that childhood illness can come back much later in life in the form of shingles. Shingles is a painful, blistering rash, usually in a strip on one side of your body. Shingles is caused by the varicella zoster virus. This is a herpes virus, but is not the same as herpes type 1 and herpes type 2 that are sexually transmitted. Varicella is the medical term for chickenpox, and zoster is the medical term for shingles. Both conditions are caused by the same virus. Once a person has chickenpox, the virus goes dormant and stays in the body. Most of the time, our immune system keeps the virus from coming back, but even decades later, the virus can re-emerge as shingles. This happens along the path of a single nerve called a dermatome and is only on one side or the other of the body. Most commonly, it's on the chest or abdomen, but can happen to the eye or the mouth, and that's more serious. According to the Centers for Disease Control, about 1 in 3 people in the U.S. will have shingles in their lifetime. Shingles affects only people who have been previously exposed to varicella zoster. According to the CDC, most people in the U.S. born in 1980 or earlier have had chickenpox. Chickenpox vaccine has been widely available in the U.S. since 1995. Shingles most commonly happens in people older than 50. People over the age of 60 are more likely to experience severe complications. You can't catch shingles from someone who has shingles, but you can catch chickenpox from someone with shingles. They're different illnesses caused by the same virus, but you have to have chickenpox first because shingles is a reactivation of the virus. The fluid in the shingles blisters has the virus in it. The rash is only infectious when the blisters are weeping. The initial red rash is not infectious, and the rash is not infectious once the blisters have crusted over. Why someone gets shingles is not clear, but a weakened immune system is likely involved. This can be from cancer treatments or medications that decrease immune system function, HIV, or simply due to aging or chronic illness. It is rare but possible to get shingles more than once. If you have shingles, you should not be around people with decreased immune system function. Those who are pregnant can transmit the virus to the baby and should limit exposure to anyone with shingles. Shingles is treatable if you treat it within 3 days after the rash appears. Treating it can help prevent complications and help lessen the severity of the infection. One of the complications of shingles is post-herpetic neuralgia. This means the rash goes away, but the pain stays, sometimes for weeks, sometimes permanently. The Shingrix vaccine should be given after age 50 and is a series of 2 doses, 2 to 6 months apart. It can prevent shingles from happening, or if it does happen, make it less severe. It also decreases the risk of post-herpetic neuralgia. As always, talk to your healthcare provider and remember to call an elder. They've been waiting for your call. I'm Dr. Arie Vino, and this is Health Matters.